Hello, 405. Welcome to Lab 1, Pre-Activity Health Screening. For today's lab, the objectives are to go through the pre-exercise health screening. So going over all those forms, the informed consent, review the screening algorithm, the Part Q, and health history form, and also go over the cardiovascular risk factor analyses. We're also going to collect the baseline measurements, height, weight, resting heart rate, and resting blood pressure. And then I'll go over lab 1, the results and discussion section. So professional responsibility, let's talk about that. You are responsible for the safety and well-being of an individual under your care. And the standard of care, these are benchmark behaviors or actions that are, at least in theory, universally exhibited by properly trained and experienced professionals. And these could be followed through the guidelines for exercise testing and prescription by the ACSM, the American College of Sports Medicine, where you can follow good standard of care. And negligence is a failure to conform to a reasonable standard of care. So your standard of care, that's being able to respond to any reasonably foreseeable emergency. So being one step ahead and looking out for the health and safety of your client. So providing appropriate pre-activity health screening is the best thing that you can do before starting an exercise program with your client. Demonstrate professional competence. Protect the privacy of your clients when they disclose information to you from the Part Q, the medical health history form. Protect their privacy and their data. Post appropriate signage for risks that could be disclosed on the informed consent as well. Provide supervision for youth, right? If you're working with teenagers or kids, making sure that you are keeping them under supervision and also having the appropriate standard of care for children and looking out being safe for your client. Conform to relevant laws, regulations, and published standards, right? That could be from the professional setting where you are at, that facility, or the ones that are any other laws or regulations from either that business, establishment, and so on. All right, so this is an overview of the pre-exercise screening process. That's the 7-step comprehensive screening process. So there's a lot of things going on here. The questionnaire screening forms have the informed consent, the Part Q, the medical health history, signs and symptoms of disease and medical clearance, coronary risk factor analyses, even lifestyle evaluation and disease risk classification. This is a little bit outdated. It's from 2012, and I will show you the most recent pre-exercise screening process from the ACSM 11th edition guidelines. But I did want to keep this and show all of you these so that you keep in mind that these are all different steps that you can take in order to do a overall well-rounded pre-exercise screening. We're going to go over the informed consent, the Part Q, the medical health history, and signs and symptoms of cardiovascular, renal, metabolic disease. All right, so the purposes of the pre-exercise screening. One is to reduce the level of risk associated for the participant with regard to fitness assessments and fitness programming. It's also a component of the standard of care that's required by the trainer or provider of services, and it must be performed before starting the program. This is a must, right? Right before starting an exercise program, have to perform this. So some goals for the pre-exercise screening is, number one, determining the current level of physical activity. Some clients might have previous experience with exercise. They either have played a sport growing up or they're currently engaging in a sport, they're exercising, they go into a gym, or maybe not. Maybe they don't have a lot of experience exercising on their own or with a trainer or with someone under their care. So we have to determine what their current level of physical activity is. Also, identifying signs and symptoms of cardiovascular, metabolic, or renal disease. And this is very important to identify individuals that might present some signs and symptoms, but also to determine if they do have a diagnosed cardiovascular, metabolic, or renal disease. And also, this is where we can determine the desired intensity of exercise. Once we have determined their current level of fitness, and if they present any signs and symptoms of cardiovascular or metabolic renal disease, then we can establish at what intensity of the exercise, either a light, moderate, or vigorous intensity of exercise. So using this information um, for creating general recommendations for either if we need medical clearance versus specific recommendations for medical exams or exercise tests. So, for example, if your client does present signs and symptoms of cardiovascular, metabolic, or renal disease, then you might need that medical clearance. And you might have to determine specific medical exams to perform before starting an exercise program. Or maybe not. Maybe you don't need medical clearance. You don't have to refer your client to their physician, and they can start exercising and starting the exercise program with you right away. And so this leaves the matter of clearance to the discretion of the healthcare provider. Minimizing risk of liability. This is very important thing that you establish when you're performing the pre-activity or pre-exercise screening. You have your clients read, understand, and sign an informed consent. You perform the pre-activity health screening and risk analyses. You can also minimize risk of liability by following the ACSM guidelines for testing and fitness assessments, by developing exercise prescription based on ACSM guidelines using information collected during the health screening and fitness assessment. You can also minimize risk of liability by documenting everything that you do with your client and also every recommendation that you make for physical activity. And the most important one, you minimize risk of liability by monitoring your client's progress, by monitoring your client as they're exercising, and by adjusting the plan accordingly as you're moving through the exercise program. So this is the informed consent. In class, you'll have the chance to read this with your lab partner and fill it out. So the informed consent tells the person what they are going to do and what risks and discomforts they may experience during the fitness assessment or as they're doing following an exercise program. It's written in layman terms, so it's easy to follow, easy to understand for your client, and that allows them to fully understand it and ask questions if they have any. You're going to have your client read it and sign it, and you're going to review with them, and if they have any questions, you'll answer them, and that will be a form that you will be able to determine if they are still willing to participate in the exercise program or even on that research study that you're performing, right? This is something that we perform before start a research study and you're recruiting subjects is something that they have to fill out as well so that you can determine whether or not they're still willing to participate or not. The release of liability helps protect you from claims made against you, and it must be a separate document and not included as part of the informed consent. So this you'll get practice in lab as well. You'll read it at your own pace and you'll sign it. So some legal claims that cannot be waived are first aid, CPR certifications, gross misconduct, which is the action or omission of the reckless disregard of the consequences of the safety or property of your client or another. And there's clearly intentional misconduct. And insurance policies, you can consult with an insurance professional or legal counsel to help you with this. There's professional organizations that may provide some insurance, like the ACSM, that provides insurance and for example, personal trainers or exercise physiologists. So in case there are claims being against you, you were protected, right, by those insurances. They have general liability and professional liability. There's up to 2 million per occurrence recommended by ACSM. So they recommend, and of course, personal injury for defamation. Right, this is the 2020 Part Q. That's the physical activity readiness questionnaire for everyone. And this is something that you'll encounter a lot moving forward in your career. This is a questionnaire that presents general health questions. And it's very easy, very simple to follow. You can give it to your clients and they can start filling it out by themselves. As you can see, there's a lot of instructions. So over here at the top, it says, please read the 7 questions below carefully and answer each one honestly. Check yes or no. So first thing that you gotta do is fill out that box, questions 1 through 7. And if you answer no to all the questions above, you're cleared for physical activity, right? You can start exercising right away with your the exercise physiologist, the personal trainer, whoever you're going to start that exercise program with. And you do not need to complete the other pages, pages 2 and 3. This is a screenshot of the first page, but there's more, right? It's up to 3 pages. If you answer no to the first 7, that's it. You can stop there. You don't need to fill out the other pages. But if you do check yes to any of those, then you must answer pages 2 and 3. Your health history form, this collects data on clinically significant diseases and risk factors. So it identifies medical conditions that may require exclusion until evaded or better controlled. It aids in the recognition of special needs, and the information gathered needs to be protected, right? That's part of the privacy of your client, that you need to keep that data safe and private. Since it asks questions like, have you ever had any of the following, right? Cardiovascular disease, pulmonary disease, or metabolic disease, and so on. So you get practice in lab as well, filling out this form. All right, this is the 11th edition screening algorithm, and there's 2. This one is for currently sedentary individuals. So you can see it says on the top here, does not participate in regular exercise. And this is the second one. This is the algorithm for currently active individuals that are participating in regular exercise. So this algorithm is very, very important. This is step number 1 on determining whether or not your client needs medical clearance and at what intensity of exercise it is recommended for them to start. So this is figure 2.2 from the American College of Sports Medicine, that pre-participation screening algorithm. So, for example, if your client does not participate in regular exercise, and from your pre-activity screening process, filling out the forms, you know that they do not have any cardiovascular, metabolic, or renal disease, and they do not have any signs and symptoms suggestive of cardiovascular, metabolic, or renal disease, then medical clearance is not necessary. And you can start the exercise program at light to moderate intensity exercise. And you can gradually progress to vigorous intensity exercise following the ACSM guidelines. Right, this is the column on your algorithm all the way to the left, this first column right here. How do you know if your client is a regular exerciser or not? Right, the ACSM has this established. So as designated, participants classified as current exercisers should have a history of performing planned, structured physical activity for at least moderate intensity for at least 30 minutes or on 3 or more days per week during the past 3 months. So you know that your client is a regular exerciser if they meet this criteria. They perform planned, structured physical activity at moderate intensity, at least 30 minutes on 3 or more days per week in the past 3 months. So that would be me. In the past 3 months, I've been consistent with exercise. I train minimum 3 days per week for a minimum of 30 minutes per day, right? So I am a physical, regular exerciser. So if that applies to me, then I would use this algorithm, right? That algorithm that participates in regular exercise. So after performing the pre-activity screening, filling out all of those forms, the health history form, the PERQ, the informed consent, medical health history, you can follow through this algorithm. So if your client does not have any cardiovascular, metabolic, or renal disease, and they do not present any signs and symptoms suggestive of cardiovascular, metabolic, or renal disease, then medical clearance is not necessary, and you can continue exercise at a moderate to vigorous intensity. But what happens if your client does present any signs and symptoms suggestive of cardiovascular disease? Then you can look at the other columns, right? And you can follow through the recommendations. So let's say our client is a sedentary individual. I would use this algorithm over here. For my client that's sedentary, does not participate in regular exercise, and there are signs and symptoms suggestive cardiovascular disease, then if it's regardless of the disease status, medical clearance is highly recommended. And following the medical clearance, light to moderate intensity exercise is recommended, and then progressing from there. The same thing if someone is a regular exerciser and there's signs and symptoms, you must discontinue exercise and seek medical clearance. And then they may return to exercise following that medical clearance and gradually progress from there. So now let's talk about those things, the major signs and symptoms suggestive of cardiovascular, metabolic, and renal disease. If your client presents any of these are considered your signs and symptoms. So if they have pains that may be associated with ischemia, chest pain, right, shortness of breath at rest or with mild exertion activities, dizziness or syncope, orthopnea or paroxysmal nocturnal dyspnea, ankle edema, palpitations or tachycardia, intermittent claudication, known heart murmur, unusual fatigue or shortness of breath with usual activities. If your client presents any of these, then you must um, write down that your client presents signs and symptoms. So this is just a summary. Your ACSM 11th edition goes in a lot more depth, but these are summary, most important ones. This is table 2.1. The summary of major signs and symptoms, suggestive cardiovascular, metabolic, and renal disease. So again, takeaway from this slide is that if your client does present any of these, or if any of these are suspected, then medical clearance is needed. Now, for pulmonary diseases, some individuals with pulmonary disease may require medical clearance prior to the initiation of an exercise program. And it says some individuals because it really depends on your client. It's like a case by case situation where if they present asthma, for example, but they have been cleared by their physician that they can do physical activity, they can start exercising, then there's no problem for them to initiate the exercise program. We'll talk more about this on our Lab 10, the exercise prescription for special populations, because there's important information about this specific population. But most of the times, some individuals may require medical clearance. So careful attention to the presence of signs and symptoms, cardiovascular metabolic disease, are guaranteeing individuals with COPD. That's chronic obstructive pulmonary disease. So the presence of pulmonary or other diseases remains an important consideration for determining the safest and most effective exercise prescription. Right, now let's move on. Let's talk about the cardiovascular disease risk factors and defining criteria. This is table 2.2 for your ACSM 11th edition, the cardiovascular disease risk factors and defining criteria. So over here in your table, you can see the positive risk factors, negative risk factors, and the defining criteria. So positive risk factors for cardiovascular disease, things that put you at a higher risk of cardiovascular disease, right? If you're at age, for men, more than 45 years old, for women, over 55 years old, you're at higher risk for cardiovascular disease. If you have family history of myocardial infarction, coronary revascularization or sudden death before 55 years old in the father, other male first degree relative before 55 years old in mother, and other female first degree relative, right? Cigarette smoking, if you're a cigarette smoker, you're at higher risk. If you are a sedentary, physically inactive individual, you're at higher risk. Body mass index as well. There's the defining criteria for blood pressure, for lipids, and blood glucose. So performing the cardiovascular risk factor assessment is very important for the development of your exercise prescription, lifestyle modification, and cardiovascular disease risk education, right? You can talk to your client about the positive risk factors in a positive way and with the intention of educating your client that if they start exercising, they're going to eliminate a risk factor for cardiovascular disease, right? Also, if they stop smoking, they eliminate a risk factor. If we can do some modifications to their diet and improve their lipids and blood glucose, then they can be at lower risk for cardiovascular disease. So it is an important opportunity for a one-on-one education about cardiovascular disease risk reduction. And if any, list your clients' cardiovascular disease positive risk factors and then negative risk factor. HDL is a negative risk factor because HDL is considered, as you might have heard before, one of your good lipoproteins, one of your good lipids. So if you have an HDL greater than 60, you can deduct one of the positive risk factors from here. So for instance, my client does meet this criteria, HDL 60, and their age is for men over 45, and their family history, they do have family history of myocardial infarction. The HDL was over 60, then I could deduct out of these two positive risk factors, I can deduct one, making it one, right? It's a very simple, easy explanation. That's essentially how you can determine risk factors. All right, so here's an activity. This is an example, a case study to conduct the cardiovascular disease risk factor assessment. So this is case study 2. There's a man, age 45 years old. He's a non-smoker. That's the height, weight. The BMI is 22.8. Resting heart rate is 64. The resting blood pressure is 124/78 grams mercury. Total cholesterol, 187. HDL, 39. And he is a recreationally competitive runner. He runs 4 to 7 days per week, completes 1 to 2 marathons and numerous other road races every year. And he's not taking any medications other than over-the-counter ibuprofen as needed. There's family history there. Father died at age of 51 years old of heart attack, and the mother died at age 81 of cancer. So let's go over our table, right? Cardiovascular risk factors. It's their age. It's a yes, because he is a man of age 45. And we can see here that the positive risk factor, the defining criteria, men over 45 years old. Family history, yes. Father died at age 51, right, from a heart attack, and mother of cancer. He's not a cigarette smoker, so that's not a positive risk factor. He's very physically active, right? So there's no obesity based on the BMI. Hypertension, no. Dyslipidemia, yes. As we can see from the lipids, the LDL over 130. Let's see. Excuse me. Total cholesterol, 187. For total cholesterol, that positive risk factor, lipids, your defining criteria. Where is it? Over here. 130 LDL, high density lipoprotein cholesterol, less than 40, 100 and less than 50 for women, and total serum cholesterol over 200. So it's a little bit high. The LDL and total cholesterol. Diabetes, no. So HDL too. The HDL over here is 39, so not be considered as negative risk factor. So for a total of risk factors, you can see number of cardiovascular risk factors is just 3. Age, family history, and dyslipidemia. All right. When in doubt, medical clearance is necessary, right? Requested if you're in doubt and You may require to follow up if there's restrictions placed on your client. And please do not proceed until the medical clearance is obtained for their physician, right? And follow all recommendations that they make. And there is a form that you can follow too as well that's posted on Lab that we're gonna get practice with as well. Right, for your lab methods, you're going to fill out all of the forms and you're going to be interviewing each other, filling out all these forms. For lab, you're also going to be getting in partners and record resting blood pressure and resting heart rate, height, and weight. We'll go over that in lab. And for your lab manual number 1, you're going to fill out the results section, heart rate, resting blood pressure, fill out the discussion questions and the activity. The last thing that I want to finish off with is, again, that summary, a quick overview of the pre-exercise screening process. This is the most updated one from the ACSM 11th edition guidelines. This is figure 2.3 of your book. So step number 1, first things first, determine if there are any signs and symptoms, right? Cardiovascular disease. Check off if any of these apply. And if you did mark any of these statements, stop and seek medical clearance before starting the exercise program. Step number 2, establish if they're sedentary or physically active individuals, right, based on ACSM guidelines. If your client performs structured physical activity for at least 30 minutes per day at moderate intensity for at least 3 days per week in the last 3 months, determine yes or no. And step number 3 is determining any medical conditions. Has your client had any of these, or do they currently have any of these? After evaluating steps 2 and 3, if you did not mark any of these statements in step 3, medical clearance is not necessary. If you mark step 2 yes, and marked in any of the statements in step 3, your client may continue to exercise at light to moderate intensity without medical clearance. And lastly, if you marked in step 2 no and marked any of the statements in step 3, medical clearance is recommended. Your client may need to use the facility with a medically qualified staff. So top takeaways, follow this figure for your exercise screening process and follow the algorithm where you have 2 for sedentary and physically active individuals and determining if they have any signs and symptoms, their current physical activity level, if they need medical clearance, and then you'll be able to determine what intensity of exercise they can start the program with. Thanks so much, everyone. Happy studying. I'll see you in lab.